All right, so this is EBP Group 4's presentation on optimal pain control following bariatric surgery, and it is presented by myself, Lauren Redding, Kate Turner, Kylie Cox, Tori Hill, and Gabriel Steves. All right, so this is the general slide of our project, and it covers the way that we broke down the research into smaller sections, how we researched, and the nursing implications of this research. So, like why is it important and some of the key findings that we discovered doing this project. The concise summary is that pain management following bariatric surgery is pretty complex and it can be effectively managed through many different pain medications and avenues. It'll vary from patient to patient. However, as shown in the small photo of the stomach in the bottom left of the slide, understanding how the surgery works and what kind of pain the patient will be experiencing is pretty crucial to this research. As this project goes on, my fellow classmates will further break down this slide into its bits and pieces. Kate is going to be presenting next on the background and significance of this research.
Thank you, Lauren. When developing our PICO question, we wanted to determine if there was a difference in pain relief with opioids versus non-opioid analgesia with the consideration of the adverse effects. Looking into the background and significance of this question, it was shown that many patients who had never used opioids for pain control prior to bariatric surgery had a higher risk of developing an addiction compared to those who have opted for other methods of pain management. Our goal is to determine if pain can be relieved with non-opioid analgesia and limit the additional side effects such as respiratory depression and constipation in hopes of preventing an opioid addiction within the postoperative community. Our search strategy included the heading terms analgesic, bariatric surgery, and pain management. Our keywords were non-opioids, opioids, pain relief, and side effects. Other parameters we included were articles published between the years 2016 to 2021, peer-reviewed journals, evidence-based practice, randomized control studies, clinical trials, as well as a limit on age of 19 to 44 years old. We used the databases PubMed, Cochrane Library, and Medline for our research as well. Now on to Tori about the synthesis of evidence.
Thank you, Kate. Next up, I'll be talking about the synthesis of evidence table. This table explores and compiles the 5 different articles from our article analysis papers that best provide evidence to support our PICO question regarding pain control following bariatric procedures. It contains the type of evidence each article explores, including the type of studies that were used in each article. It shows the different sample sizes used within each study. It summarizes the findings from each article that was chosen. Each article and study had its own respective limitations that are also shown within this table. And then we finally went through each study and article that we chose, and we used the research appraisal tool and the evidence level and quality guide from Johns Hopkins to identify the evidence rating associated with each article chosen. In this table, it kind of summarizes everything that we're going to talk about in this presentation. And next up, Kylie will review the findings involved in each article and how it applies to our overall PICO question.
Thank you, Tori. I reviewed the findings of our articles. 3 of our 5 articles were ways that could potentially decrease the need for opioids post-operatively. The first article discussed the use of magnesium and ketamine preoperatively and during surgery, which then resulted in a decreased need for opioids. The second article analyzes the use of ibuprofen and acetaminophen in an attempt to decrease the need for opioids. The third article talked about using dexmedetomidine to decrease the necessity of opioids post-operatively. Our last 2 articles emphasize the need to reassess the amount of opioids being prescribed. It has been found that many patients have leftover opioids. Our main limitations were small sample size and information based on self-reporting, such as surveys. Now, Gabriel will discuss the implications of nursing practice in summary of our presentation.
Thank you. This is Gabriel Steves, and these are the implications for nursing practice. We found that there was indeed potential for equivalent or even improved analgesia in patients when nurses implement ordered non-opioid analgesics. This reduced dependence upon opioids potentiates reduced incidences of the side effects common to opioid analgesics and eliminates the potential for addictive behaviors associated with opioids. In summary, 3 of our 5 sources were randomized control trials, while the other 2 were a retrospective chart review with a phone survey and a multi-site observational report. All sources were concerned with various alternatives to opioid analgesia in patients recovering from bariatric surgery. Our summarized conclusion is that numerous non-opioid alternatives exist that supply pain relief equivalent to their opioid counterparts without the associated side effects. References are supplied on the last slide of our presentation and include hyperlinks for your convenience. We would like to take this opportunity to thank you for taking the time to view this YouTube video and to extend a special thanks to the faculty and staff at the University of West Florida. On behalf of myself, Kylie Cox, Tori Hill, Lauren Redding, and Caitlin Turner, thank you for viewing our presentation.